The BirthRx program is an individualized program for women that are pregnant and typically don't have a whole lot going on as far as pain and symptoms, maybe a little onset of something, but it's mostly a program to help women move through their pregnancy and keep working on their fitness, keep exercising, keep working, keep doing whatever physical tasks that are important to them through the pregnancy, and help them through to have the confidence to know that what they do is not hurting themselves or it's not dangerous in some way. I think a really important feature of the BirthRx program is that we are constantly monitoring changes as they happen so that women can differentiate what's a normal expected change during pregnancy that is not something to really think too much about, and what is something that is a sign we should back off of exercise in some way, and then what is a sign that I actually need to call the doctor because something's not right. So that's what pelvic PT can be really helpful with during pregnancy as we're looking to prevent the things that we can prevent. A lot of people that I see during BirthRx will tell me that movement is important to them, or their job or their workout is important to them, and so we'll go through their goals. And typically they'll come from their medical providers, and they'll usually be told what exercises are unsafe for healthily carrying a baby that we know of. So that's all good. Basically that we don't want to do anything unsafe, we don't want to fall, we don't want to overexert ourselves. That's all true, and that's probably info that you get from your medical provider. However, the info that many women don't get from their medical provider is, how do we know if what we're doing is causing a problem like pelvic organ prolapse or stress urinary incontinence or a diastasis that maybe is going to be long lasting through postpartum? Because there are preventive strategies, there are signs, and there are ways to monitor for those symptoms, and we can change the mechanics or the way you're breathing or the way you're moving to address those things in order to set you up for a more easy transition physically into postpartum. So I think that being able to prevent those issues, while it's a different discussion than safety with exercise, I think preventing those issues that can sometimes need a lot more medical intervention and things like that later is really important to a lot of women. So BirthRx is all about identifying what's important to you now and into early postpartum as far as your physical status and fitness and mobility.